it for this webinar. About our speaker today, Allison Righter. She's a dietitian within public health. She's an Eating for the Future program officer at the Johns Hopkins Center for a Livable Future at Bloomberg School of Public Health in Baltimore. The Center for Livable Future engages in research, education, policy, communication, and outreach surrounding the complex interrelationships of diet, food production, the environment, and human health. Allison primarily coordinates the science advisory for the Meatless Monday campaign that offers a unique nutritional perspective to many other food system projects at the center and seeks ways that the Center for a Livable Future can engage more with dietitians. Graduating from the Johns Hopkins University, the Bachelor's in Public Health Studies in 2010, Allison completed a coordinated master's program in dietetics through the Johns Hopkins Bloomberg School of Public Health and the Bayview Medical Center. She's a graduate research assistant at the Center for a Livable Future with the Baltimore Food and Faith Project for over a year before starting her current full-time position in March of this year at her complete dietetic internship. She's also a current member of our Public Health Community Nutrition Dietetic Practice Group and also the Hunger and Environmental Nutrition Dietetic Practice Group. Welcome to Allison.
Thank you, Lauren, and a big thank you to the Public Health and Community Nutrition Group for sponsoring this webinar and making everything possible, and of course all of you for signing up to listen to this. I'm very excited to be here today. It's a very appropriate day to have this webinar given that it's a Monday, so happy Meatless Monday, everyone. As far as learning objectives, my goal is that by the end of this presentation, you should all be able to explain the history and rationale behind the Meatless Monday campaign and our involvement at the Center for a Livable Future, recognize the value of using weekly periodic messaging to promote healthy behaviors, which I'll touch on briefly, discuss the scientific evidence regarding meat consumption trends and the health and environmental implications, and this is where I'll be spending a big chunk of my time. You should be able to discuss the practical application of Meatless Monday and to identify what resources are available to you and how you think you can incorporate it into your practice. So Lauren gave a good little overview of the Center for a Livable Future, but this is just our concept model. We are an academic center at the Bloomberg School of Public Health, founded in 1996, and as this model shows, we work to explore how among constant pressures from population growth, climate disruption, resource depletion, and lack of equity, how these four components, diet, food production, environment, and public health, all shape our lives and our future. And I've been integrally involved in the Meatless Monday campaign since it was first started in 2003 when our director, Dr. Bob Lawrence, was talking with former advertising mastermind Sid Lerner about how to reduce saturated fat in the American diet in order to prevent chronic disease. Well, the 2010 Healthy People goals of the time was to cut back on saturated fat by about 15%. So Sid, being the quick thinker, mathematician he is, realized that that works out to about 3 meals out of 21 or about 1 day a week. And he remembered back to his Boy Scout days about the Meatless Monday idea that was promoted during World War II as a rationing strategy for the soldiers and decided to revitalize it as a public health initiative. And so that's the story of how Meatless Monday campaign as it exists today came to be. And we at CLF continue to work closely with the campaign team, serve as a technical and scientific resource in harnessing our expertise within Hopkins to give public health significance to this initiative. And so that's what I coordinate at the center. And before I went to the science behind why meatless, I wanted to just briefly touch on the why Monday, what's so special about Monday. Even though some of us may have come into work today feeling like this cartoon character on the left, our research tells us that Monday actually tends to be viewed more positively and can be used as a very powerful behavior change tool. CLF conducted 2 literature reviews a few years back, one that showed how periodic messaging can help improve the effectiveness and success of health promotion programs, and one that revealed of the cultural associations of Monday as the beginning of our weeks and a day for a fresh start. So with these, we realized that Monday can be used as a potentially powerful cue to action, which is a term used in the health belief model of behavior change communications. So we can tap into these naturally weekly rhythms to help people start and sustain positive health behaviors. And it's 52 Mondays a year. That's 52 regularly occurring, predictable opportunities to improve health. With this research, what started with just the Meatless Monday campaign quickly branched out into a whole slew of other campaigns, an entire organization called the Monday Campaigns, which is currently based in New York, and whose mission is to help end chronic diseases by getting individuals and institutions to commit to health on Mondays. So using the power of Monday, they promote a variety of health campaigns, which you can see it pictured on the right in this diagram. No real paid marketing. Their strategy is essentially a bottom-up and top-down approach, working on the grassroots level trying to spread this movement. Monday has been their most successful and most popular campaign so far, but I just wanted to give you a little bit of a background and context about the whole organization under which Meatless Monday is housed. And I highly encourage you to check out their website for more information about that. Now on to the real meat of my presentation, no pun intended. In order to address this question of why meatless, it helps me at least to systematically address these 4 questions. How much meat are we eating? How does this compare to recommendations? What are the nutritional and health implications? And what are the other implications of meat consumption? Now, first looking at how much meat we're currently eating, this is a recent graph from the Earth Policy Institute that shows U.S. meat consumption per person over the last 100 years or so. And as you can see, our meat consumption has nearly doubled in the last century, increasing most dramatically starting in the 40s after World War II with the industrialization of agriculture, when we began to really ramp up meat production, food production in general, for very, very low cost. But if you notice, the graph begins to trail off at the end in recent years. So what we're starting to see now is that meat consumption has in fact decreased by about 12% in the last 5 years, likely due to food prices and potentially some health concerns. And though we expect this to likely continue, we're still eating quite a bit of meat. I want to get specific estimates about how much meat. This is where it gets a little bit complicated. Because there's so many different data sources that say different things, as you can see in this chart that I've illustrated below. So on the one hand, you have the USDA food availability, which basically measures available meat per person. So this doesn't take into account any losses, plate waste, spoilage, any of that. And then in the middle, you have the loss-adjusted data, which does take into account some of those losses. And then you also have the dietary intake surveys measured through NHANES, which are actual consumption data, and that's somewhere in 5 to 8 ounces per person per day range. And then a different way to look at NHANES data is to do a usual intake estimate, which is more on the low end of about 4 ounces. So, you know, it's hard to say, and I just bring this up because there are a lot of different sources that might read, oh, Americans are eating 12 ounces, Americans are eating 12 ounces of meat a day, or Americans are eating, you know, not as much meat. So it's not always an easy answer, and I just advise you to be cautious when you see a claim, really understand what data source you're using. Now, in our consumption patterns to the rest of the world, the United States is one of the highest meat-consuming countries in the world, and this top chart on top is using data from the United Nations, and it's using that high estimate for the U.S. consumption. And even still, you know, we're consuming well over the global average of about 100 pounds per person per year, and considerably more if you look at the lowest meat-consuming countries like India or Bangladesh, which only consume, you know, 7 pounds per person per year. So huge disparities here between developing and developed countries. But what we're starting to see is that the demand for meat is increasing rapidly worldwide as overall population rises and as developing countries are adopting more westernized high meat diets with rising incomes, which is paired in the larger graph below. that meat consumption increases with rising GDP. So we're only expecting meat consumption to continue rising worldwide. Now back to the U.S., if you break this down by the type of meat we're eating, you'll see that there's been an enormous increase in poultry consumption over the last 50 years or so, and that beef consumption peaked in around the 70s and has been on a decline ever since. But if you add up pork and beef as the two red meats, you'll notice that half of our meat intake is coming from red meat sources. And looking at the NHANES data, we can estimate that probably about a quarter of our total meat intake is processed meat, which includes, bacon, sausages, hot dogs, deli meat, and that could be red meat or white meat, just to make clarification. So these last few slides should give you a pretty good idea of where the data stands in terms of measuring how much meat we're actually consuming. Now on to the second question about how this compares to recommendations. Well, I'm sure you're all very familiar with the MyPlate graphic here. And we know that there aren't specific recommendations for just meat, but that meat is included in the protein foods group. It also includes fish, eggs, legumes, or products, nuts, seeds, etc. And as we also know, most adults need somewhere around 5 to 6.5 ounce equivalent servings per day from this group. And the recommendations are to eat a variety of protein foods, choose lean meat, more fish, and increase consumption of fruits, vegetables, all these nutrient-rich foods that we talk about. Now, those are recommendations, but again, if we look at the data to see what's actually going on with our diets, we realize that our total intake from the protein food group exceeds recommendations, and that meat accounts for nearly 3/4 of our intake, so the large majority of our intake. Now, know that meat can offer a range of health benefits and be a good part of a balanced diet, good source of protein, B vitamins, iron, etc. Just to bring up this protein question more specifically, because that just seems to get all the attention when we talk about meat. So the recommended daily allowance is 0.8 grams per kilogram, which works out to be somewhere between 40 to 50 grams for women, 50 to 60 grams for men. And this includes protein from all sources, not just from the protein foods group. And if you compare these recommended amounts to actual consumption patterns based on NHANES data, you'll see that men and women are eating considerably more protein than necessary, roughly 1.5 times the RDA, and actually close to twice the ERA, the estimated average requirement. Again, same pattern here, the majority is coming from animal sources. And the animal sources, as we know, tend to be higher in saturated fat compared to nutrient-dense plant-based sources of protein, which offer a whole range of other health benefits. So we really need to consider the entire protein package of a food and not just protein as an isolated nutrient. So we understand these general meat consumption trends. Let's look more at the specific health implications. And these two bullet points pretty much sum it up. Now, measuring the effects of meat consumption on health is an extremely complex issue. A growing body of research generally supports the conclusions that diets high in meat, particularly red and processed meat, increase our risk for heart disease, stroke, obesity, diabetes, and certain cancers, while on the flip side, diets high in fruits, vegetables, whole grains, and beans prevent these same diseases. So I'm just going to run through some of the latest research on this, citing a couple key articles, and I've included the citations for each of these, so I highly recommend you go back and read through these sources more carefully if you're interested. The slides will be posted on the website afterwards. So starting with obesity, which is an epidemic of huge proportions in our country and around the world, as we know, some prominent studies have found meat consumption to be associated with a higher daily caloric intake, a 27% higher risk of obesity, which is a 2009 study out of Hopkins, as well as weight gain during follow-up, which was done in a large-scale prospective European study. These studies compared people who ate the highest amount of meat to those who ate the least amount of meat or no meat, and saw that these increased risk for obesity and related factors. For diabetes, there's been more research in recent years linking specifically processed meat to an increased risk of diabetes by as much as 32%, which was a 2011 study out of Harvard. Associations have also found to exist for all processed meat, total red meat, and total meat by the amounts in the parentheses here, which are based off of meta-analysis looking across the literature. For cancer, there's been a lot of evidence about the association between red and processed meat and an increased risk of total cancer mortality rates, and I've cited 2 studies here that you can check out. And then the landmark report by the World Cancer Research Fund and the American Institute for Cancer Research, which includes a very comprehensive review of the literature broken down by each specific cancer and food type. Concluding recommendations for cancer prevention is ultimately to limit intake of red meat to less than 3 ounces per day with very minimal, if any, processed meat. And then because they found that red and processed meat are convincing or probable causes of certain cancers. Now, they do clarify in the longer explanation for the recommendation that also shows that many foods of animal origin are, nourishing and healthy if consumed in modest amounts, but that ultimately, in terms of cancer prevention, it's important to watch out for red and processed meat. Heart disease and stroke, again, we see similar trends. This first study is out of Harvard, is a systematic review and meta-analysis that found for each serving per day increase of processed meat, there was a 42% high risk of coronary heart disease. And it wasn't statistically significant, but trended towards a positive association. And for stroke, this was a study just published this year in the American Heart Association Stroke Journal, looking at red meat consumption and risk of stroke. And this was another meta-analysis that looked across prospective studies and found an increased risk of total stroke for each serving per day increase in total and unprocessed red meat, with a slightly higher risk for processed meat, up to 13%. Finally, looking at mortality from all causes, total mortality. I'm sure many of you remember from earlier this year the release of the red meat and mortality study out of Harvard, looking at 2 prospective studies with over 120,000 participants for more than 20 years that found a 12% higher risk of mortality for every 1 per day increase for total red meat, and to 20% if that meat was processed. And you can see this dose-response relationship in the graph here, showing an increased risk of mortality for each increase in servings per day. And then they took it one step further to show that if participants substituted red meat with fish, poultry, or other plant proteins, this significantly lowered their risk by up to 19%. So that's just an overview of some of the latest research on the health risks associated with high amount of red meat, particularly red and processed meat. But what is it specifically about meat that increases these risks? So obviously there's a lot of factors that play into health and disease risk. So meat is just one piece of this puzzle, and there are many proposed mechanisms for why this is. Now, let's talk about one would probably be the high saturated fat and cholesterol content of many meat products. And this fat content gives meat a higher energy density, which could potentially contribute to higher caloric intake and eventually weight gain over time. With processed meats in particular, the nitrates used in the preservation process can be converted to carcinogenic compounds that could also impair insulin response and lead to diabetes. The cooking methods for our meat products, the high heat cooking methods, can form carcinogenic compounds like cyclic amines and polycyclic aromatic hydrocarbons. Say that 3 times fast. HCAs and PHAs. There's also been some evidence about the iron in red meat, which we know is an important source of iron, but in high amounts, this actually might increase oxidative stress and promote the formation of these N-nitroso compounds and insulin resistance. So, example of some of the proposed mechanisms. And finally, a very likely hypothesis also is that people who eat a lot of meat and animal products are also likely not eating a lot of fruits and vegetables, which have a health protective effect on their own. And just to briefly highlight this point about how diets high in plant foods can decrease the risk of the same diseases that a high meat diet can increase, there's a growing body of evidence on the health benefits of vegetarian diets, like the Academy's paper discussing the nutritional adequacy of a well-planned vegetarian diet, and some of the results of the Seventh-day Adventist health study out of Loma Linda University, which the most recent results found that following a vegetarian diet could actually increase lifespan by more than 9 years, which is pretty amazing. And they have a bunch of other papers out there on this data set also. You don't have to or need to be a full-time vegetarian to reap these health benefits. I think we'd all agree that pretty much everyone could benefit from some more fruits and vegetables and whole grains and all that good stuff we try and get people to eat, since Americans always have notoriously low intake levels. And naturally, by adding more whole plant foods into our diets, we can decrease the amount of calories, saturated fat, cholesterol, sodium in our diets, while increasing the amount of health protective vitamins, minerals, phytochemicals, fibers, and all that good stuff. And for more information, I would definitely recommend the Plant Powered Diet book, which was just published earlier this year by Sharon Paulman, and she actually just she actually just recently gave a webinar sponsored by Today's Dietitian about some of these benefits of a plant-based diet. So that's a great resource. Now that we understand the nutritional and health implications of our high meat diets, which I know we care about as dietitians the most, I think it's important to broaden the discussion to look at other implications. And for this, we really have to step our comfort zone a little bit and think outside the box and outside our traditional dietetic training that for a lot of people probably focused only on nutrients and individual health, to think critically about the bigger picture of where our food comes from and what that means for health more broadly. I know a lot of us have this idyllic vision of farming and would like to think the meat we eat is produced by this happy cow grazing on a beautiful pasture somewhere. But unfortunately, that's not really the case anymore. And the majority of our livestock are raised, stock and poultry and other food animals are raised more like this in massive high efficiency confinement facilities. But what does this really mean? And I wanted to touch on this real quickly. I know this is kind of a busy slide, but the industrialization of our systems for producing animals for food, which has occurred over the last 60, 70 years, has been able to produce a lot of food and a lot of meat very cheaply. It has done so with what we call external costs that are unfortunately not accounted for in the price we pay for our food, but have major, major implications for both public health and the environment. And this is something that we as dietitians should, absolutely be aware of, how all of this interrelates and is ultimately linked back to health. So this, could be an entire lecture all on its own, and this is a lot of the work of CLS, what we do here. But I wanted to give you a sense of how complicated and overwhelming this issue of meat consumption can be when looking at how it affects all these different systems, from climate change to occupational health hazards to resource depletion to antibiotic resistance to food safety, et cetera. It's all connected back somehow to our industrial production system. There are a lot of really great infographics out there right now, and here's one of them that was released very recently by the International Food Policy Research Institute. And again, this highlights a lot of these big issues with meat from more of a global perspective. That for some countries, as I mentioned earlier, they might have too little meat consumption, which has result in nutritional implications, but then too much meat isn't good. And if you look at the effect on global food security and climate change and resources, you know, it's a very complicated picture. And there was actually just an article also in the, I think it was the October issue of the Nutrition Action Health Letter, if any of you get that. They also had a nice little article about meat's impact on some of these different issues, which I was happy to see. So what this really boils down to, oh, and my slide's not working. Let's see. No. There we go. So what this really boils down to is that our current industrial methods of meat production and consumption are both unsustainable in terms of environmental health and also in terms of feeding a growing population, which is expected to reach 8 billion by 2025 and up to 9 billion by 2050. So how are we going to feed all these people? And it's estimated that we would be able to do this if everyone ate primarily a grain, plant-based diet, but that if everyone ate as much meat as we do here in the United States, we would only be able to feed up to 4 billion people. So in short, bottom line, Houston have a problem. And as I was writing this slide, I thought it was appropriate that Scentsy is in Houston next year. So you know, that could be the theme for next year's Scentsy. So anyway, so I hope I've given you a sense of the depth and breadth of problems related to meat consumption and production. But the good news is that there are viable solutions. And there isn't just one magic bullet solution because we do need both supply and demand side changes that establish policies, give incentives for making the production methods more sustainable. But experts across the board really agree that one of the most significant thing we can do as individuals is to reduce our meat consumption in order to create a healthier, more sustainable, more equitable world. But the real question is, how can we do this? What are the effective strategies? People don't like being told what to do. How can we tackle this problem? And finally is where the Meatless Monday campaign comes in. And you know, it's just one small but potentially significant piece of this solution puzzle. And I really view it as a useful tool not only to raise awareness about all of these issues that I've just discussed, but to actually start influencing behavior change, which, as we know, is always a challenge. What's really worked for the Meatless Monday and allowed it to become as widespread as it is now is just, it's super simple, just 2 words. You understand, you know, what you're supposed to do is right in the title, and it's not a big ask. Often people have this knee-jerk reaction thinking that we're, you know, Meatless Monday is some sort of crazy animal rights agenda or trying to take people to consume whey or end meat consumption altogether, and that's simply not the case. There aren't strict rules. We're not asking people to out meat entirely, but just cut back once a week. And that's definitely a low-cost strategy that often saves people money. And it's fun. The graphics and marketing materials and everything are really catchy and fun and cool, and it's been pretty successful. And so I can see here over the past 10 years with the campaign, it's really turned into a movement and a global movement. And all this with virtually no paid marketing. This is happening on a very grassroots level with food bloggers and magazines picking it up for the regular content, and then you have big-name celebrities and chefs like Paul McCartney with his Meat-Free Monday in England, Mario Batali here, the self-proclaimed Prince of Pork. You have Michael Pollan, who's mentioned it while on Oprah back in 2010. So all these big names create quite a buzz around it. And then schools and college campuses catch on, and then more restaurants and workplaces and cafeterias. And most recently, the City Council of Los Angeles passed a resolution encouraging all residents to go vegetarian once a week. And that's, you know, quite a bit of press, and even a spot on the Today Show this past Monday, a few weeks ago. So the movement is definitely happening, and it's out there. The challenge has been, you know, trying to quantify it and see what's going on. And the campaign team has tracked increasing awareness of the campaign on a national scale. since it started back in 2003. We have done this through an online survey, and we saw a peak of up to 50% in 2011 and just around 43% this past July. That little dip is likely to some changes in sampling strategies with the company we worked through, but even 43%, hovering around that area is still pretty significant for a health campaign. And then this past year we worked to try to add some questions to the survey to start getting at the behaviors that are changing as a result of this campaign. And you can find the full summary of findings on the Meatless Monday website or on the CLF website. But just to highlight a few key findings, of those who were aware of the campaign, 36% said that it influenced their decision to cut back on meat. And of those who were influenced to cut back on meat, 62% say they've incorporated it into their weekly routine. So again, we're into those natural weekly rhythms. And then we want to find out what people were eating instead of meat, and we found that the majority of people reported eating more fruits, vegetables, and all those good things we want people to eat. So continuing to work with the campaign team to refine these surveys and to try and capture how the campaign is influencing behavior and do little pilot programs in different settings. But these are some fairly positive preliminary results that we're pretty excited about. It also helped with the survey just last year with 245 sodexo sites across the country had been encouraged to implement a Meatless Monday campaign when Sodexo rolled it out to their clients in 2011. And though this was a subjective survey that went out to site managers, we got some pretty positive feedback that 30% of the site managers that had participated in the Meatless Monday campaign reported decreased meat purchases, and 46% reported increased vegetable purchases, all while maintaining and in some cases increasing sales in certain places and maintaining or increasing customer satisfaction. Probably the most important finding for Sodexo as a company was that the majority of providers from both corporate and healthcare sectors noted that they perceived the campaign as a demonstration of Sodexo's commitment to health and wellness, and it was a good fit for their sustainability plan that they have as a company. So it's exciting to see Sodexo's report for this and engaging in those conversations about how to continue with this campaign moving forward. Now that you have a good background about the campaign, let's talk about how you as a registered dietitian can put it into your own practice. It's just such a natural fit for our profession as the leading food and nutrition experts, and a lot of dietitians are already promoting it in a lot of different ways. And a few months ago, I had sent out just a very informal survey through a few DPG listservs to get a sense of what RDs were, if RDs were familiar with the campaign, how they were already promoting it, why they were promoting it, etc. So if any filled that out, thank you. Some of these slides are informed by some of the feedback I received. And finally, like I said before, it's just Monday is another tool to add to your repertoire for helping clients with some of these things listed here. This emphasis, this last point about using Meatless Monday as a platform to help clients understand the broader implications of our food choices, to be mindful of what we're eating and what the implications of those choices mean, not just for our personal health, so that's very important, but broader food system and environmental sustainability level as well. So, just to go through some examples in different settings of how Meatless Monday could play out. So in the food service setting, you could start a campaign in your cafeteria, and this works a lot of different ways in different cafeterias. It's not about cutting out all meat options on Mondays. It's generally just promoting whatever vegetarian you likely already serve on Mondays. Signage and communication materials and table tents, or you could host a Q&A table on Mondays and answer people's questions. And the biggest thing here, too, in terms of our dietitians, is to work with the dining staff and the chefs to make meatless options not only meatless, but healthy and tasty. So not just, pizza or grilled cheese, but what are some other, ethnic cuisines or other nutrient-rich, satisfying, hearty, meatless meals can we add? In the community setting, you could host a group cooking class or demo featuring healthy plant-based recipes to really teach people how to cook with these great plant foods and improve their self-efficacy for cooking. And you can engage the community by planning a recipe challenge or bringing in a big-name speaker or a film screening or something fun to get people engaged and get the conversations rolling. And in the clinical setting, you can work with clients, counsel clients on the benefits of cutting back on meat, if they're suffering with high cholesterol, etc. Help them cut back on that and assist them with the meal planning process and giving them ideas for how to take those baby steps and just, start on Monday, see how it goes, take it easy. And, really working to expand the horizons by encouraging them, using this as an opportunity to try new foods and expand their palates for certain vegetarian options. And along the way, if they have nutrient concerns, if they're not going to get enough protein, help work through that with them, which is what, we already do with dietitians, so that's just another tool to add. And in any setting, really, do what I do, which is research and educate others on the wide range of benefits of cutting back on meat. Meatless Monday has a recipe widget you can add to your website or your blog. You can send out Monday or Sunday night reminders through your company's internet or your own personal emails or newsletters, and just encourage your family, your friends, your coworkers, your clients to join the movement via social media. And here are just some sample quotes I picked out from people who completed the little informal survey I talked about, and just showed how they're implementing Meatless Monday, what effects that they're seeing. This first one up top is from an RD PhD in Texas, who not only has a private practice and counsels students, but also teaches undergrad classes and has students create and analyze weekly menus with one meatless day each week. The co-founder of nutritionbabes.com includes Meatless Monday recipes and blog every week. I mentioned Sharon Palmer in her new book. She's been a huge advocate for Meatless Monday out on the West Coast and plant-based eating in general. The bottom left corner is a quote from a woman in an outpatient clinic who suggests Meatless Monday is a strategy for patients with high lipid panels, and she's witnessed some good improvements. And then in the bottom right corner, a nutrition student intern actually sent me this picture of a big display board she created while at a summer internship at Kaiser Medical Center in San Diego that started a Meatless Monday campaign in that cafeteria. And just, they're just some real-life examples to highlight, and hopefully this has sparked some interest and allow you to think about how you could potentially work it into your own life and career. And just to make you aware of all the resources that are out there to help you. It's interesting for me, one of the things I realized when getting feedback from other RDs is that a lot of people didn't actually realize that Meatless Monday was a campaign with an organized website and social media presence and all these great resources. So I do encourage you to visit the Meatless Monday website to see everything that's there, whether it's recipes, news stories, toolkits for getting a campaign started in your community or your workplace or the hospital cafeteria or schools, and they have all these free downloadable promotional materials. And again, everything's free, it's available. They're happy to hear from you about what you're doing and how they can help support and also highlight your work through their social media network, which is over 36,000 fans on Facebook right now. So it's amazing. And on my end, from CLF, I would also encourage you to visit our website featured here. We also have a great blog and Facebook and social media and all that fun stuff. But our website, we just recently created a page of resources related to Meatless Monday and meat consumption, sustainable eating more broadly. And more will be coming soon on that. It's kind of a work in progress right now. And just to highlight 2 resources that I definitely recommend you check out. One is the Environmental Working Group Meat Eater's Guide to Climate Change and Health, and then the Healthcare Without Harm's Balanced Menu Program, which challenges hospitals to serve less meat and higher quality, more sustainable meat. So if you're working in a healthcare setting, it's a really great tool, great program to explore. Any questions, comments about the campaign, getting started, using materials, sharing your success stories, please email the Meatless Monday people in New York, and they would love to hear from you, or just contact them via social media through their Facebook page. And then for any, more on the research side, if you have any questions related to the research or the evidence or any resources you're looking for, please feel free to contact me. My email address is listed here, and anyone through the Public Health and Community Nutrition Group can connect you to me as well. And I'll just end with this quote that I came across just a couple weeks ago. It sums it up very nicely. So as changing the eating habits of the world's population will be difficult and slow to achieve, a long campaign must be envisioned, along with incentives to meat producers and consumers to change their production and dietary patterns. Healthy eating is not just important for the individual, but for the planet as a whole. So I thank you all so much for listening to me today, and I look forward to addressing any comments or questions you may have. Thank you.
Thank you so much. And on behalf of the Public Health Community Nutrition Practice Group, I just want to thank you for taking the time today to present round 2 of Meatless Monday for another group of members. So I really do appreciate that. And I'm going to look at questions and see if we have any from the group. And I did just send out the link. This is the survey you will need to fill out in order to obtain CEUs. Will also be emailed, once you finish this survey, you will be emailed the link to our Public Health Community Nutrition page in which you can print out your CEU certificate for your own records. And I've just been notified that the slides have been posted to our Public Health Community Nutrition website as well. So you should be able to access those there. We are also going to post the recording shortly, probably within the next couple days, on our website, so that if you do want to listen to this again, or if another member would like to listen to this again, they can do so on our page. And again, the link, I'm going to send the link actually to the for everybody right now as well. That, and then we'll get into some questions. Actually, this link coming to you all right now is actually also for the CEU certificate and the PowerPoint. So you're going to be able to find everything here. Okay, everyone should have received that. It's www.phcnpg.org/page/webinars. That's webinars plural. Okay, so let's take a question here from the audience. As for recipe choices, Allison, are you including using vegetarian stock so that the meal recipe is completely meat-free?
That's a good question. And unfortunately, I don't have a specific answer to that. I think it just is really going to depend on what the needs of whoever you're serving it to are. We don't have a strict definition of what meatless is or what vegetarian is, but I think it's just important to communicate that to the audience. So just have a little tag by that food and say vegetarian, includes vegetarian broth or includes meat broth, because some vegetarians are stricter than others. I think it could go either way with that.
Thank